Hello, my name is Elizabeth Hannagan, and my presentation is called Lead Exposure is Entirely Preventable. So why aren't we doing more to protect New Hampshire's children, families, and communities? Indeed, this is a complex problem. And I would have to say for us, the hardest part of this experience as parents of a lead-exposed child is managing the fear of the unknown. I'm learning to cope with things like hearing other people say that our child may have irreversible brain damage, or he may likely never reach his full potential. The other hardest part of this problem as a parent is feeling helpless, that loss of personal power that comes from being unable to remedy the situation ourselves, to fix it. I imagine other parents with less support, resiliency, and resources than our family has. And I wonder, how do they cope? And how do they manage such a crisis in their lives without it derailing them? Time constraints, financial challenges, and other social determinants make it difficult for families like ours to make changes quickly enough to be able to positively have an impact when a child's been exposed to lead. So each day that goes by without the change, it becomes one more hazardous day for the child. And many people, myself included, had assumed that blood levels below 10 micrograms per deciliter are safe. But because we've had to become more educated, we now know that with each new year, scientists are actually finding out that there really is no such thing as inconsequential amount of lead in a child's body. Many states and communities have implemented laws to address lead exposure, but those efforts have been fragmented and underfunded. So I'd like to share with you some of the ways that we could make a difference for New Hampshire's families. And I wanted to share with you a slideshow of my children and my family. So our story really begins about a year and 2 months ago. We got a call from our doctor saying that our youngest child's exposure had been confirmed at a higher than reference level of 5 micrograms per deciliter of blood. It triggered an expansive and crucial protocol of intervention that we were not ready for. Rules can vary from state to state and city to city, but lead exposure and poisoning requires swift action that can, depending on the severity of the child's exposure, involve a host of health department officials, case managers, primary care physicians, the WIC office, housing investigators, landlords, and other personnel. Our home was immediately suspected of being ground zero of the exposure, meaning it needed to be inspected and the lead remediated. With the support of a public health state coordinator, my husband and I began the arduous process of becoming educated on what a child's exposure means and how to deal and live with it. Next, we had to share the newly acquired information with all of the caregivers in our child's lives because they needed to support our reduction efforts. And so I found myself becoming a voice, sharing about lead and how it impacts families. So what can we do about this? Well, there's no easy quick fix. It's going to require significant policy and regulatory action, coordination across levels of government, and public and private investments. But it has the potential to generate substantial economic and public health gains in the short and long terms. The maximum potential benefit of preventing all lead exposure could be $84 billion. So what is the solution? In our case, it would have been removing the lead paint hazards from the low-income housing that was built before 1960, before our children spent time there, before we moved in and lived there for 6 months. A year and a half later, we were still living in the same apartment. And I was really starting to get frustrated, and I started to feel that hopefulness slide away because I knew that each day was a hazard to my son. And I knew that the landlord was doing everything he possibly could to remediate the issue. But even with his cooperation, which many families don't have, the process takes too long. New Hampshire needs to pass legislation requiring inspections of properties built pre-1978. This has already been done in places like Rochester, New York. Housing inspections may be triggered by a new certificate of occupancy, such as in our case, if it's a rental property. It might be a renewal of an existing certificate, a neighborhood survey, a referral by an outside agency, like our organization, Community Action Partnership. It might be triggered by a complaint, as ours was. And to receive a certificate, property owners must correct identified lead hazard violations. But in order to do that, they need the resources to do so. In our case, our landlord was able to apply for funding to help support the cost, but he did share with me that his personal out-of-pocket costs for actually abating the lead was going to be upwards of $150,000. And he did share with me too that he never intended for our family to be hurt by lead. It wasn't even something that was on his radar. In our case, our landlord was fined by the EPA for not sharing with us the lead documentation that the house was built before a certain time and could contain lead. So I do feel like he will think about lead in the future. But he did mention that the legislatures have to come up with something that supports families to get them out of this situation. Because once the lead hazard's been identified, really within 30 days, the family should be rehomed. Because that really stopping that lead exposure, my son's lead level is down all the way to a 3, thanks to all of our efforts. But we couldn't get down to that level until we moved into our new home and the source of the lead exposure was eliminated. You know, in our case, as I researched this paper and this topic, I wanted to know more about the impacts of lead. I wanted to know what could be the potential outcomes for my child. I wanted to know the community supports and resources that existed to help us. And in a way, it was almost information overload. And so I would say to you, if you're working with families, be mindful of how overwhelming the research can be, because much of the research around the consequences of lead exposure or poisoning is quite disheartening. In our family's newfound understanding of the complex health consequences of our son's exposure, we've chosen to experience this from a place of hope. But some families may need help getting there. We've been able to reclaim some of our personal power in this situation by implementing intentional, thoughtful interventions designed to mitigate the negative outcome and impact. We may not have been able to prevent exposure due to circumstances beyond our control, but we can now decide how we will face these challenges as parents, professionals, and community members. Thus, as a parent of a child suffering from lead exposure, it's become my great responsibility to speak out on behalf of my children and indeed all of the children of the state of New Hampshire. This problem has lingered for too long. States and communities have figured out solutions that are working, and we should follow suit. We should figure out what's working where and how we can implement that in our state. It has devastating and costly consequences for the children and communities of New Hampshire, and it's entirely preventable. And until it happened to me, I never even had any idea about it. So we need to educate people and get the word out We need to not wait for children to show up at the doctor's office with elevated lead levels before acting. And we can do more. The increased public awareness and scientific evidence that lead exposure or lead poisoning is completely preventable makes this a critical moment for action. We need to protect children. We need to enhance their opportunities to succeed, and we need to reduce the cost to taxpayers. Please help in doing your part.
Thank you, Elizabeth, for that talk and for sharing your story and those photographs with all of us. We have some time available for questions for you, so I'm just going to let the audience know. You can type any questions you might have for Elizabeth in the Q&A, which is on the right-hand side. You can click on Q&A or chat, but the Q&A is where you would type any questions you have for the presenter. So I'm just going to give people a minute to put any questions in that chat. And thank you so much again, Elizabeth, for sharing your story.
Absolutely. Thank you for having me today.
While we're waiting for any questions to come in, I had a question for you. It was really interesting to hear about everything that you've learned and the research that you've done. Did you know anything about lead before this happened?
No, I actually didn't really know anything about lead, which is odd because I have a degree in anthropology and my background is in early education, and really that birth through age 5. So I'm sure that somewhere in a textbook there was a tiny little paragraph about it. But as far as how it actually is affecting people in real life, I had no experience whenever. It's been quite a journey for my husband and for myself to kind of navigate this together, and really it's brought us closer.
Okay, yeah, it sounds like you have really learned a lot. Is there anything else that you would like to share if there's any parents in the audience today? Any sort of takeaways that you wish that you had known, maybe even like the most obvious thing that you wish you had known before any of this happened?
Yeah, I think the biggest thing is if I had known about the length of time that it would have taken for this process, I maybe would have designated some resources to get ourselves out of that apartment. It is hard in the state of New Hampshire because we are in a housing crisis as well, and there's not a lot of places for people to go. And so we did kind of look into other places to rent, but we found that they also had lead issues, or they were out of our range as a working family of what we could afford. So I would really tell families to always have a nest egg, a backup, so that you can take action. I would have definitely gotten my son out of the exposure sooner. We were blessed through a local community nonprofit called Habitat for Humanity to get into the home that we're in now. And it's completely free of all hazards and safe. So the other thing that I would say is parents, be open to accessing the resources that are there, because I didn't have any idea about how many great organizations in New Hampshire are working on problems like these. And that was kind of like the great aha moment of all of my research, was like, look, people are working on this and we can put our voices and our minds together. And the parent voice is super important. Yes. So how to engage parents to help increase awareness. Our local WIC office is actually how we gained the awareness. So I would definitely say investing in those programs that reach, local community clinics and places where pediatricians' offices for well child visits, places where parents are already naturally bringing their children for health is a great place to step up that awareness campaign. I don't know how many properties my landlord owns and manages. I do know it's very many, upwards of 100. My landlord really did right by us. I have to say that it's very true that many landlords don't do right. As soon as I reported the issue to my landlord, he took steps to remediate the problem. He let them come in. He let us put up duct tape. He replaced our door, which was identified as a source of the hazard. He tried to repaint friction surfaces. So he really tried to do the best that he could do. And the one thing that he didn't do, and I did ask him as we were parting ways, why didn't you do this? He didn't offer to put us up anywhere else. And so that I definitely think should be something that should be addressed, is there should be some sort of rule or law that gets children rehomed within a shorter time frame. And landlords could be part of that solution if they have safe and open available apartments to move families into.
Thank you for answering this question.
You're welcome. And for HFA, I am a home visitor. It's Community Action Partnership's Healthy Families of America program.
We have a couple minutes left before the next presentation. If there are any more questions for Elizabeth. If there are no other questions at this time, I want to thank you, Elizabeth, again, for sharing your story and sharing your experience and your advice for others, and your willingness to come talk to all of us today. We really appreciate it.
Thank you so much. I really appreciate the opportunity to take positive steps to impact this problem. It helps me to find the good.
Thank you. So we'll be getting started with the next presentation on the main stage in just a couple of minutes. So if anyone has trouble with it showing up with them, just refresh your browser. And thank you again, Elizabeth.
Thanks, Jess.